expected there. But we are going to begin with Calgary police trying to track down the source of some dangerous drugs after a deadly overdose. The CBC's Brian Labby has been digging into this story for us today, and he joins us now live from the newsroom tonight. And Brian, the details around this particular story, they are so very heartbreaking.
Yeah, that's right. 4 children have been orphaned after their parents died of what police are calling a drug overdose. It was their 14-year-old son who found the bodies on Saturday morning, and it's not yet known the type of drug that was involved.
There is an investigation ongoing through the medical examiner's office to try and find out cause of death. We do have a criminal investigation that we're looking at. We always try and ascertain what was there and how they had access to drugs that were potentially illegal, and that's what we're looking at right now.
And Brian, you spoke with someone who helps people with addictions issues. What did he tell you?
Well, Peter Choate is an assistant professor of social work at Mount Royal University, and he has worked with thousands of people who are battling addictions. Now, he says that parents shouldn't be blamed for this tragedy. He says the community let them down by not providing enough help.
Where did we go as a society to not find our way into helping that family? What happened that family felt that drugs was the solution for their pain or for their difficulty, as opposed to services in the community? So I think we as a community should be asking those bigger questions than simply saying, oh, these are bad parents.
Choate says the 4 children will face enormous challenges coping with the deaths of their parents. Now, as for the type of drug that was involved in this case, it could take months before the toxicology results are known.
As we say, so very sad. Okay, thank you, Brian. That's CBC's Brian Labby live in the newsroom tonight. And as Brian mentioned there, officials still don't know exactly which drugs were involved in that case, but nobody in the know would be surprised to hear that carfentanil is involved. Since late summer, the deadly opioid has been linked to 15 deaths in Alberta, 5 of those right here in Calgary. Intended to be a sedative for elephants, the drug is 100 times more potent than fentanyl, another drug that has had a devastating impact in our province. My next guest is on the front lines of the fight against the opioid problem in our province. Dr. Hakik Virani is a public health physician and addiction medicine specialist. Welcome to the show.
Thank you, Rob.
I know this case here in Calgary is reminding you of another in British Columbia. Remind us about that one.
Yeah, so a couple in North Vancouver who has a toddler son died of a fentanyl overdose earlier this year. The cases, though, are starting to meld together. Every story is as tragic as the previous one, but it's seeming like a new normal, and that's really inexcusable. We really have to get a handle on this problem.
Okay, let's talk about how to get a handle on it in just a second. But first, 15 carfentanil deaths in the province so far this year. I'm wondering what that tells us about just how prevalent this drug might be. What does that indicate to you?
So deaths are always the tip of the iceberg, and we would assume that the case fatality rate, or the number of people exposed to carfentanil who die, would be high. But we also know that this drug has been seized by police in months gone by. We know that it's present in Alberta. We know that it's been present in BC. They had a seizure in Waterloo. So it's widespread, and it's really a result of us not nipping this thing in the bud.
Is this stuff manufactured?
Yeah, so
illegally?
So what we think is that this drug is being shipped from probably China. And it's done so in very small packages, we would assume. I mean, as you said, carfentanil is thought to be about 100 times as toxic as fentanyl, which means that a kilogram of fentanyl could be packaged in a 10-gram envelope for carfentanil, and that would accommodate 1 million doses, euphoric doses of the drug.
Okay, you say not enough is being done. What should be done about this issue?
So there's a few things that we know in public health make a difference in reducing the number of opioid overdose deaths. The widespread distribution of naloxone is critical, especially when we're dealing with a drug this toxic.
This is the antidote.
This is the antidote to opiate overdose. It rescues people who've overdosed on an opiate. We need more access to harm reduction services like supervised drug consumption services. The government is contemplating this and providing funding for communities to explore this possibility, but we need to move a lot faster on that. To me, though, the most critical thing that we've ignored or not certainly acted urgently enough on is access to medication-assisted treatment for people with opioid addiction.
So what sort of treatment are you talking about?
So the medications that are most used in what we call agonist maintenance or medication-assisted therapy for opioid addiction are one called buprenorphine, or the trade name Suboxone, and for some patients, methadone maintenance treatment programs. we don't have nearly the number of treatment spaces that are required, and we've not escalated that access as urgently as we should have.
And you've set up a clinic in Edmonton. You're actually in Calgary to do the same thing, and you're doing this outside of AHS. That's how desperate this situation is. You don't want to wait around.
Well, you know, I'm fortunate to be in a group of like-minded colleagues who really have been watching this problem grow for the last 10 years or so with extreme concern. Yeah, we're impatient. It's been a number of years since Blood Tribe in southern Alberta declared an emergency in their community. We've not seen nearly the amount of action that should have occurred in terms of access to treatment, and so we're going to give it a try here in Calgary.
And how badly is it needed then in Calgary?
Well, as I said, deaths are the tip of the iceberg, and we're on pace to see somewhere between 450 and 500 deaths in this province alone in 2016. So you can imagine that the numbers of people who are struggling with opioid use conditions is orders of magnitude above that 500. We have fewer than 5,000 people in treatment. That's not nearly enough.
If you're doing this outside of AHS, who's funding it, this clinic in Calgary?
Well, providing medical care is an insured service, but of course all of the kind of administrative tasks and the ancillary services that need to be provided in conjunction with medication-assisted treatment, we'll have to figure out a way for our doctors to pay for that.
Well, maybe you'll see this interview, somebody out there, and they'll step up. We hope so.
One would hope, yeah.
Dr. Varani, it's really nice to meet you. Thanks for coming in.
You as well. Thanks, Rod.
All right. Well, the director of the watchdog organization that's supposed to be overseeing Alberta's car dealership industry has been fired by the provincial government.